So lately I've had quite a few athletes with mid-back and like rib cage pain in the office, and it's becoming common enough that I wanted to make a video to show you guys what I'm looking for, so that if you are dealing with pain around your mid-back, like where your rib cage and your shoulder blade are, maybe this video can help uncover why and show you exactly what you can do to fix it. So I've had athletes, not only cheer athletes, but baseball players, basketball players, and some volleyball players in the clinic lately that have had mid-back or what they consider to be rib shoulder blade pain. And one of the things that I find most common with these athletes is a discrepancy in how much they can turn, which is why I have my two friends here. So I'm gonna show you guys a really easy test that you can perform yourself and see if there's a big discrepancy in how you twist, just like these athletes. And if so, then we're gonna show you what you need to do to correct it so you can help to get rid of that pain in your mid-back. So the first thing we're gonna do is we're gonna take a bolster. This is just a cylindrical pillow. You can use a foam roller, you can use a basketball, anything that you can get between your knees to squeeze the knees so that it locks your legs and hips in place and does not allow them to move a whole lot, okay? We also wanna make sure our feet are flat on the ground, and we're gonna grab a PVC pipe or a broomstick or a wooden dowel, something long enough that we can put it across our shoulders so that we can lock our upper body in place. So we're gonna place that right across the front of our shoulders here, and we want to try to avoid sliding up and down with that. We want to really lock it in to our shoulders. Now forgive me if I get muffled because my microphone is right here by my neck, so try not to bump that too much. But what we're looking for is we want to squeeze here, hold that pipe directly across our shoulders, and we're gonna rotate as far as we can without cheating. We just want to pure rotation, get pure rotation here. Then we're gonna rotate back the other direction. And what we're looking for is how close does the edge or the end of my pipe get to midline? So if you have somebody that's watching from the front, they're gonna be looking at the end of the pipe as it comes back around towards the middle. Now what I tend to see in the clinic is I'll have one side where we get really good rotation, and then the other side where they get to about here and they start to feel some cramping, or they start to feel pain in the area of their mid-back. And what that indicates is that we are losing the ability to rotate through our mid-back, and the muscles in the mid-back are either getting tight as a response to that, or they're the cause in the first place. So either way, it uncovers a very big thing that can create pain in the mid-back or around the rib cage. So if we do have that restriction, or if we see, honestly, if we see a restriction both ways, if we see barely able to turn one way, barely able to turn the other, that also is not great. We want to ideally be able to get the end of the PVC pipe on both sides to midline, or pretty close, within like this range or so. So if we have that restriction, what we can do is first of all grab our foam roller. We're gonna lay back onto the foam roller, arms crossed across the chest, bracing our core. We're gonna roll up and down through the mid-back, right where we have some of that tightness or where we have some of that discomfort. We can also work on extending and flexing on the back to help loosen that up as well, and we can even do some side-to-side bends. Spend 2 to 3 minutes on the roller. I like to get a little bit more time on there versus trying to rush through it, so 2 to 3 minute minimum. It's usually pretty good, and the mid-back on the roller feels really good for most people. So after we get done foam rolling, we're going to grab our PVC pipe again, place it over our back, and again, forgive me if I get muffled with my microphone, but we're gonna place this over our mid-back, and what we're gonna do is we're going to turn towards the side that we had our restriction. So let's say if I was testing and I barely got any rotation this way and it was really uncomfortable, that's the side I want to work on. So I'm gonna place it on my shoulders. I'm going to twist, trying not to let the hips do a whole lot, twist with my back as far as I can comfortably, and then from there I'm gonna lean towards the back and really stretch that out, and then come back up. Now reset, and then I would twist, lean to the back. Okay. Once you do a few reps of that, we're gonna come back, then we're going to twist, we're gonna lean to the opposite side, so lean to the front and stretch that out. And then back to the middle, and we would twist towards our restricted side, lean towards the front, and stretch stretch that out there. So what we're doing here is we're creating rotation in the mid-back first, which is where we have our deficiency. So we're trying to get into that. And then we want to work those different directions of the upper back, really exploring all the space that we have there. Once we get done with like 5 to 10 twists and leans on both forward and back, what we would do is just grab our roller or our bolster, whatever we had to squeeze between at the beginning of the test. We'd squeeze that again, retest our rotation and see, did I get further and or is it less uncomfortable? Each day you'd want to perform that rolling and rotation until we are able to get back to midline or back to equal with rotation on both sides and when our pain becomes decreased. But by adding this into your daily stretching routine can truly help to increase your range of motion and get rid of your pain if you're having pain in your mid-back around your rib cage. One really important thing, guys, don't forget is if you are having back pain that does not seem to go away, this is for, purely for educational purposes only. We definitely don't want to ignore pain and simply just try stretches if we're not sure what it is that we're stretching. So if you're having pain that is not seeming to go away, please make sure to check with your healthcare provider because there are some other odd things that can create pain in that area that we don't want to miss. And so if you're having pain there, definitely make sure to check with your healthcare provider to make sure that these are appropriate for you. If you'd like more videos on stretching and mid-back and rotation exercise, things like that, click the link above. If you haven't already subscribed to the channel, click the link here, hit the bell for notifications so you know when we come out with new videos, and definitely check out hitzeronutrition.com, the only health and wellness product line specifically for cheerleaders. We'll catch you on the next video.